My patients trust me. That's why I trust LifeNet Health.
In our state-of-the-art facility, LifeNet Health is working for the patient 24/7, 365 days a year. We are committed to quality, service, safety, and innovation. This is where it all starts. Our trained professionals are available around the clock to answer the calls that save lives and restore health. LifeNet Health is a leading regenerative medical company specializing in organ, tissues, and bioimplant technologies. Each call we receive is screened to determine if it's a suitable donor. If a donation is possible, the case receives a donor ID number and a more detailed screening process begins. We understand that we are stewards of a gift. There is a name, a face, and a life associated with every donation we receive. We turn grief into hope. To ensure safety, we perform every test necessary to screen donor recoveries and transplants. Our state-of-the-art lab conducts over 15,000 tests a month in areas including serology, analytical chemistries, environmental testing, and microbiology studies. And we utilize the latest lab techniques such as NAT, nucleic acid test. When a donation arrives at our facility, we use a biometric passcode system to ensure the highest security and safety. Our facility is also designed to reduce the risk of cross-contamination at every step. We have an access control system that codes employee badges and provides limited entry to controlled areas. And in critical locations, we've installed hands-free exit and entrance doors. At the time of recovery, we wrap and inventory each item of the donation using a donor identification number. We know from the documentation exactly what has been recovered. The recovered tissue is then held in a controlled temperature environment until it is cleared for processing. The freezer room is maintained at an ambient temperature of about 0 degrees Fahrenheit. Using a liquid nitrogen injection system, the freezer compartment is kept at a constant -65 degrees Celsius. Donated tissue is the most precious resource for LifeNet Health. Everything possible is done to ensure that the donations will result in a successful bioimplant. As part of a comprehensive review process, our quality assurance staff maintains detailed charts on all donors. Once a careful and thorough review of all necessary documentation and testing is complete, one of the LifeNet Health medical directors will clear the donor for processing. When quality assurance releases a donor, every item from the donation enters the processing environment using a special pass-through. 10 suites allow for the processing and packaging of musculoskeletal tissue in an aseptic environment. Each clean room is maintained at a Class 10,000 standard through unilateral airflow. The rooms are cleaned after every shift. The day of processing, a dedicated team of 2 to 4 people is assigned to a single donor. We produce over 300 different bioimplants. Each member of the team specializes in a particular graft type. The equipment used in the processing suites is custom designed and developed by our own prototype equipment development department. This engineering team ensures that all equipment exceeds safety and quality standards and that the bioimplants meet the critical specification and tolerances required. One room, one team, one donor. To further ensure the continuity of our bioimplant processing, we have 3 1,500 kilowatt industrial generators to back up our systems, including all critical equipment and clean room processing. You can always rely on us. Once processing is completed, all contaminated outgoing equipment is removed using the outgoing clean room corridor. This greatly minimizes the risk of cross-contamination. Instruments leave the clean room and are decontaminated and cleaned directly into the production support department. All instruments are inspected, washed, and sterilized using steam or ETO, ethylene oxide. Workers are here 24 hours to prep approximately 25,000 pieces of equipment a month. When sterilization is complete, the instruments are staged to re-enter the clean room following the unilateral process flow. After an item is packaged in the clean room, it comes here for final labeling and packaging, which includes its box, product inserts, graft implant card, and a "Thanks to You" card. This is the last step before a graft is released for distribution. Our dedicated customer service team offers 24-hour support and a bioimplant locator service. Once an order is processed, it is forwarded to our modern distribution center. About 30,000 freeze-dried room temperature bioimplants are stored in a vertical lift machine or VLM holding shelf for distribution. These packaged bioimplants are arranged by donor number in trays. When an order is received, our automated system provides yet another layer of quality control. Cardiovascular tissue is stored frozen at temperatures between -120 and -190 degrees Celsius. When shipped, the tissue is placed in a cryogenic container, which allows for a liquid nitrogen vapor phase storage system. We also produce frozen grafts used for spinal fusion and sports medicine. Behind the scenes, our research and development team is committed to product improvements and innovations to advance the safety and efficacy of bioimplants. Their work has resulted in more than 45 patents to date, and some of our technologies have become leading industry standards. It is our policy at LifeNet Health to achieve total customer satisfaction in all of the products and services we provide.
This is why I trust LifeNet Health. And this is why Natalie is now able to play sports again. How's that knee, Natalie?
It's great, Doc. When can I start back up?
Every aspect of the LifeNet Health process honors the dignity and generosity of donors and their families. Their gifts have enabled many people to enjoy fuller, richer lives. Transplant recipients are encouraged to express their gratitude in an anonymous letter to the donor's family. Recipients can share how a donor's gift has changed their life. LifeNet Health's Thanks to You program is proud to help recipients deliver their letters of thanks. LifeNet Health. Saving lives, restoring health.